But we do have a large county jail. It has a capacity of 1,600 plus inmates. Most of the time it's been running between about 700 and 800 during the COVID time period. And also right around the corner from it, we have a juvenile detention center. So we got two facilities that are housing large numbers of people for long periods of time. But at the same time, they're also a moving population and a revolving door kind of thing. So it brings a lot of complications to it other than just the nursing homes where people stay in that bed and, that kind of thing. So it was a new thing for us to look at. We got involved in it because of an outbreak at the jail.
Some of those independent living facilities are things like adult housing for the intellectually disabled and, complex medical conditions that some adults have. So these individuals live independently, often in a shared accommodation. So 2 people to 1 apartment, and then they have caretakers that they either hire or the facility hires for them. So they're not like a traditional long-term care facility where there's a medical manager and a registered nurse who's the director of nursing and skilled nursing staff.
Soon as we started going into these facilities, we found out about the process that it goes for the elderly that are receiving residency assistance. And that's when we became aware of foster homes and host homes. Most of these facilities here in El Paso, they were unlicensed facilities. So it was a little bit challenging for us to be able to identify all the facilities that we have within the county. So what we did is that we reach out to the fire department. They are the ones actually doing or providing the building inspections and compliance certifications needed for these facilities to be running. And we got a list of all of these facilities. So the plan now, it was for us to reach out to all of these facilities, and that way we can also create this baseline assessment.
Now, one of the challenges that we had was that the ICAR assessment tool has really been drafted to be used in a skilled nursing facility. So something like a long-term care facility or even some more medically managed assisted living facilities. So, one of the big gaps we saw when we started this project was these independent living facilities they fall off the edge of the radar. So they're not managed in the same way that a long-term care or assisted living facility is. So there's, a large potential for, infections and infection control to be an issue.
Building trust, that was one of the main challenges. People often think, these type of visits as being regulatory visits instead of more like, we're here to help you, trying to provide you with the resources, the information, the assistance that you need. So making sure or stressing the importance for them to benefit from these resources. That was one of the challenges that we faced. Another one is that most of these facilities, especially foster homes and host homes, they are run by monolingual Spanish speakers. And sometimes the materials either developed by the state or even some of the internal materials, they were not available in Spanish.
We work with them a lot, especially with the officers. What does it mean for the officers now? Because they go home every day, right? They work shifts and then they go home. And so some of the things that we had to look at were their protections. Most of them are officers, a very different look because they're not there to take care of these people in the sense of medical, but they're there for discipline and all the rest of it. So they have a different attitude. So we had to work with them on realizing that they could be the main source of infection, that they would be bringing it from the community into the setting where these inmates often don't move. We had to work with their supervisory staff to not have the officers as much as possible cross from one unit to another during their shift. It's a very common practice for them to move and not spend their whole shift in one, or even take on another shift immediately after theirs. And so they're in this unit for this shift, and then their second shift that they take over, they move straight into another unit. And so the possibilities of transferring infection from one place to another are pretty high.
In terms of success, there were different aspects in which we were able to gain the trust from these facilities. For example, we were able to incorporate them into our weekly call with all the long-term care facilities, so that way they can benefit of the information that it is provided through all, not only to the licensed facilities or not only to the ones classified as long-term care facilities, just the satisfaction of being able to provide those resources when they needed it the most. Through the partnership that we have with Border Rock, they were able to get any personal protective equipment that they needed at the time that they needed it. So that way, definitely they were able to respond appropriately when they had any outbreaks, or even to implement some of the infection control practices, since most of these facilities, they lack the resources and also the funding to be able to implement those measures.
Relationships move at the speed of trust. And to have a health department come in and say, we're about to assess your facility, we've got this tool, people can be really hesitant about that. But once they meet Kate, Kate has got an amazing presence. She's very calm, she's very sweet, she's very non-confrontational. She just is, she's there to answer questions. Even when something stands out like, oh boy, that probably shouldn't be happening, she just calmly works her way around, and she's got an amazing way of reflecting back to a site, both things they're doing really well and some things they might like to consider. And it doesn't feel threatening. There's a real nuance in how you do that and how you do it well.
One of the good things that's come out of it now is that every change that they make, they reach out to us to ask, are we on board? Are we okay with it? Relationship building. It's very hard to come in the middle of a crisis and be the trusted voice, the one that really knows what needs to happen.
Know your community resources and make sure that you nurture your partnerships. Definitely having our partnership with the fire department and with Border Rock, that's what made the program a success. So definitely knowing your resources as a health department, and then of course taking advantage of those relationships that you have already built through the past of the years, and be able to use them to serve those who are most vulnerable.
Reach out early and reach out often. When we got started, I think that we had a few stops and starts along the way, just personally and different things. But to really push harder in the beginning to make that initial contact, I think would be good. Just to really stress that how important it is to start building that capacity with all the facilities and not to wait too long.